It's a partnership between your doctor having the right knowledge of the right medicines. He was a professor at IU, and I thought, I couldn't be in better hands. My name is Deborah Dant. I'm a 15-year breast cancer survivor, a patient of Dr. George Sledge. I just believe God put him in my hands and led me to the right doctors.
At the time of the recurrence of her breast cancer, Deb graciously consented to be involved in a clinical trial. And as part of that trial, she received what was then a fairly new form of chemotherapy, now a much more standard one. This actually was a quilt that was put together by cancer survivors. And this is a weeping willow. On each of the leaves, you actually have the names of patients with breast cancer. So, for instance, Paula Marie Kendrick here was a patient of mine who died of breast cancer some 15, 20 years ago, leaving behind her, probably her husband and her kids. So this is kind of our challenge every day in clinic. One of the things that I offer to my patients is involvement in clinical trials. It's the only way that we're going to move things forward. So I always try to bring my patients something a little bit above and beyond as part of standard care. In the past, whenever we've done clinical trials, we've done trials that have treated a general population of patients with drugs that have been sort of pulled off the shelf. Now we're in the process of actually looking at specific drugs and their ability to work in specific tumors based upon those tumors' genetic characteristics. Debbie's story in the future is going to be a more common one. Rather than a almost miraculous one.
You don't have to be in the losing statistics. You can be that 1 in 1,000. I don't have time to die. I have things to do. And he said, we're going to do everything we can to make sure you make it. And he did it. I did it, he did it, we did it together.